Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And Lynn, this morning, just coming into the Fug House here and sitting down, open up Facebook to get the United Methodist Church on the air, and I see there's a woman, local woman here that has been, I wouldn't say I've known her, but she was an acquaintance and a restaurateur and a young person, like my age, relatively young, and passed away today, and I know that she'd had an ongoing bout with dementia.
Oh, sad. I'm so sorry to hear that.
In her 50s, yeah. And it's been a couple of years since I heard that, and that was very sad. And then she passed today, and everybody was told here. And going back to the 80s, she was a restaurateur. A lot of people knew her and remember her food and the sound of her voice and her laughter and all of that. What's a person to do vis-a-vis dementia?
So super, I don't know, sad topic, I guess. But I found actually some really promising and somewhat weird ways that people can avoid it.
First off, dementia in somebody younger like that, that's not so...
That's a thing.
Yeah, that is.
So your risk of dementia goes up after 50, 6.3% for every 6 years.
Run those numbers again. They all
so
sound
after
together.
50.
After 50.
Risk of dementia goes up 6.3% every 6 years.
Such a specific
I know.
statistic.
Who decided that?
Wow, okay.
Oh, sorry, I didn't say that right. Actually, it's even more depressing. Risk of dementia doubles every 6.3 years.
After 50, wow.
Yeah, after 50, so it doubles. And so there's a lot of causes, but 11 to 14, not an insignificant amount of dementia is kind of preventable.
Kind of preventable. All right,
Yeah,
all right.
Potentially preventable causes here.
Okay,
So-
let's get into this. How much do we understand dementia? Is it one of those words that's
It's a syndrome.
Okay, there we go.
So it's more than one thing.
Right.
So it's not just Alzheimer's. It's not just old age. It's not just vascular related. It's not just Lewy body. You know, there's a lot of things. So it's a syndrome. And it causes pretty obvious decrease in cognition, and people end up needing to be completely cared for. It's kind of a fading away of a person.
Yeah.
Like you alluded to.
It's just one of the most, there's so many tragic ways
Right.
to be inflicted, right? Or afflicted.
Robin
I guess.
Williams comes to mind. He actually died of suicide, but it was because of his cognitive decline.
Oh my God, I did not know that.
Yeah.
I didn't remember that at all.
Can you imagine how heartbreaking?
It's heartbreaking, but heartbreaking to see it in somebody else. Heartbreaking, especially just hellish to see it in yourself. Like to be cognizant of it happening to you.
To a certain point. And
Right,
then you're
right.
kind
And
of,
then,
oblivious.
Oh my God.
Which is sad too. So I'm going to talk a little bit about diagnosis and kind of the standard things people should know. So diagnosis of dementia should include, so things we don't all have here, a detailed history, so medical history, a full medical exam, cognitive testing, which is surprisingly impossible to get here.
Really?
And isn't something somebody should go into lightly. So if somebody has cognitive testing because they're a little worried about that they can't seem to find their car keys or remember their neighbor's name, and they find an impairment, how does that affect the rest of their life? So can they do their own banking? Can they drive their car? So not something to go into lightly, and I don't think it's available here. I've been looking for it for a couple of patients, and I think maybe the new neurology in practice in town might do it.
that would seem like important for them to be able to do.
You
And
would
this is
think it was important.
more involved than like what they made Trump take, right? This is a man.
Oh, God,
this
that
is
was-
a hippopotamus. This
Oh my
is
God.
whatever.
Yeah, that was a nothing. Anyway, and it also includes a psychiatric evaluation, notoriously hard to get here, neurophysiologic testing, which I couldn't even name what that means.
Wow.
We definitely don't have it here. Labs and imaging. So, but what can a person, none of us want to go there. And what can a person do to lower their risk? And some of these are expected, but I found a lot of them to be unexpected and kind of more interesting.
Okay.
So the expected answer here is to stop smoking, exercise at least 150 minutes a week, especially aerobic exercise helpful, avoid drugs and alcohol, and take your blood pressure seriously. So, that's the one that sounds like the Charlie Brown teacher. Wah, wah, wah.
Wow, but so take your blood pressure seriously. Is that because is there I don't know, is dementia like a vascular sort of thing?
There is a type of dementia that's related to little micro strokes.
Okay.
And it's called that vascular dementia. And a lot of people actually go on and off their blood pressure medicine pretty, I don't know. They find more reasons not to take it than reasons to take it. And, or they say that they minimize it, saying they have white coat hypertension, which is still causing damage.
Okay.
So you can't make it evaporate by saying that. But here's some less expected advice here is to follow the Mediterranean diet, which is similar to the DASH diet for hypertension. We've talked about that before. But specifically, it can lower the risk of dementia by 25%.
Whoa.
Which in science land is a lot.
That's huge.
When we get excited over differences of 3%,
Right.
25% is huge.
Well, and if every 6.3 years your risk is doubling, that can help offset
Right.
some of that.
So the Mediterranean diet, or the dietary approaches to stop hypertension, which is super related.
Is that the DASH? Is that what you said?
That's the DASH diet, yeah. This is a plant-based diet focused on whole grains, legumes, fruits and vegetables, and healthy fats like olive oil. And so minimal amount of animal protein. So not much on the meat, a lot on the vegetables. Okay. But the cool thing about this is it can be protective even when somebody has genetic risk. So if somebody
I see what you're saying.
has Alzheimer's and all the elders in their family and they think that, their future is sealed, this can actually decrease risk in somebody who looks like dementia might be a genetic certainty for them.
Wow.
I think that's incredible.
That is incredible. It's not written in your genes to be expressed without it. Yeah, okay.
Not necessarily. And it's not that hard to do, and it's probably cheaper. And if you do a garden like a lot of Del Norders do, boom, there it is there. So the next cool thing is good quality sleep. And this is kind of relatively a new way of looking at how the brain is acting during sleep. So sleep is like the brain cleaning crew. It's a time for the brain cleaning crew to go through. And there's actually a flow of lymphatic fluid that kind of goes along established tracks that these are new. They're kind of, think of a blood vessel, but it's not a blood vessel.
Right.
It's not really a lymphatic drainage system. It's kind of different, but it gets forced through the brain at kind of a defined pathway, but down in the cellular level, not so defined. And it's just a cleaning crew, and it's picking up all the metabolites, all the waste that we build up in our brain during the daytime. And those waste products are like beta amyloids, which are associated with Alzheimer's. But this might be a system that also protects against other disorders like Parkinson's, schizophrenia, seizures, and mood disorders. So the thing is, it works less well. I'm older than you are, so my cleaning crew is not as efficient as your cleaning crew. Assuming that we get to the same level of quality sleep on an average night. Okay, so what that means is you have to be kind of in the deepest parts of sleep, and it has to be for enough time.
Right.
So if you are just Joe Average Del Norder and you ensure quality sleep, even as you age, you're helping out the cleaning crew to really keep you from having the buildups of the metabolites and then get into trouble later on. So huge importance. And sleep hygiene is kind of the way you do that. If you're wondering, well, like, what do I do that? I just,
What, as far as managing the times and how many blue screens you look at,
your screen exposure,
ambient light and things,
right.
yeah,
right, and maybe getting away from things like sleeping pills, which make an artificial sleep,
right,
and are not really helpful in the long run. So
I'm a devotee, recently sort of added to the ranks, a devotee of sleep. I never wanted to sleep my whole life, and as I've gotten older, I really feel it.
Were you that kid?
What kid?
Your poor mother. Your mother. My mother always tried to get me to sleep.
No. I don't know about like that small. Just like later on, like I'm a night person.
Oh, I see.
And so getting up is difficult. Getting up early,
Right.
I thought getting up is early. Now I'm finding that getting up at 6 a.m. is remarkably easy for me. Like that's a good point in my cycles to wake up.
I like it. Yeah, I've always been a morning person though.
But yeah, giving up those last 2 hours from like, like 11 to 1 in the evening has been difficult. But the benefits, just, listening to your body and sleeping the way your body wants to sleep. And wow.
Without any artificial inputs,
Yeah.
from alcohol or screens.
Exactly.
Or, all of that kind of stuff.
I try to walk away from all that at least like an hour before and have time to, but yeah, sleep well, sleep right. There's so much that it does for you in every way.
Yeah. Sleep hygiene. Look it up if you didn't hear our last discussion about it. Here's one that's really easy and super important. Hearing problems.
What's that?
Hearing problems.
I know, it's a joke.
So that can raise the risk of dementia, and it's super correctable.
Really?
Yeah, it cuts people off from their surroundings, and it can contribute to depression because you feel like that kid who's in the corner at the party,
just isolated.
Yeah, isolation.
I'll be
super
damned.
correctable.
Huh?
Hearing loss is accountable for about 8% of dementia worldwide, and it can be corrected by something as easy as just having your ears cleaned out. So earwax is kind of a hot topic for me personally.
I don't like the idea of there being hot earwax, but yes, go on.
Well, that can be good. So some random dude about 11,000 years ago in Mongolia was a man. They know that from the genetics. Had a genetic mutation. And it changed the quality of his earwax to that thick yellow stuff. That's so disgusting.
What was it before?
It was kind of flaky and white, and kind of more like big
Dandruff?
snowflakes.
Okay,
that never melted. Yeah,
more
dandruff.
like a skin sort of thing that it was.
Yeah, just skin
that
flaking.
seems much more manageable.
I know, and now we got this thick wax thing, and it's pretty much almost everybody, at least in Del Norte, and I imagine in the world, it's like the one thing that holds the world together is earwax.
That and the inability to efficiently digest corn.
Yeah.
So one guy in Mongolia.
One guy in Mongolia,
I'm trying to come up with
successful mutation apparently, although I can't see how.
Yeah, what would be the evolutionary mechanism driving the spread of that? What
I have
sort
no
of benefit
idea
is
unless
that?
it's connected to he
Something
actually
else.
had a syndrome and multiple genetic mutations, and they're responsible because it certainly doesn't make you hear the saber-toothed tiger coming.
Yeah, right.
So anyway,
That's hilarious.
I can correct that by at the Del Norte Community Saturday Clinic. I mean, when the Sutter Walk-In Clinic was there, we had some nurses who were really good at cleaning out earwax, and it is a super kindness for people.
Oh yeah.
They
You might not even know you're affected by it until you get your
Right, and it's amazing. I've walked back in the room to recheck ears, and I've heard people like, "Wow, I haven't heard the seconds on the clock."
Oh my God!
In
wow.
years.
Wow.
Or telephone conversations, and people are amazed. So if your lavage is, and the other thing is that your usual busy provider who only has 7.5 minutes, because your lavage takes like 45 minutes sometimes.
Okay.
So they'll give you Debrox. I suppose we shouldn't say brand name, but an ear waxening drop, a softening drop, and they'll tell you to go home and use it, implying that it'll just dissolve the wax. That's not what it does. It takes the wax from being dried and hard like a bean, and it plumps it up so that it's softer and easier to shoot out with a stream of water.
Oh, okay.
Okay. And by the way, you cannot clean your own ears at home. Q-tips are verboten, right? And you really personally can't get at an angle to shoot water in your ears that makes it either safe or helpful.
Wow, really?
So don't even try.
Okay, so how's that work? I have a lot of what
Are
Okay.
you related to Mongolian guy?
No, no, no.
Okay.
I just don't like being told who can clean my ears and who can't. The it's a January 6th thing I got going on.
Oh my God.
No. So what? So how come somebody else can do it? Can get the right angle to squirt water into your ear correctly, but you can't?
Because they don't live in your body.
Huh?
They live outside your body. So they can approach your ear at a different angle than you can. The other thing, too, is if they're a medical person, they know to pull the external ear back.
Okay, there's
But
that.
that's only a minor thing. You really have to, what I think you have to do is note where the earwax is.
Mm-hmm.
And ears are like, ear canals are kind of like country driveways. Okay, they go all over the place and they go up you know, they're around the bend, and sometimes, you know, the wax is a little bit more to the back of your head, and sometimes it's to the forward part of your head, or your ear canal is really narrow, like a toilet tissue tube somebody stepped on, as opposed to a really big opening, like an intact toilet tissue tube.
Okay.
So it's an art.
Okay.
Okay. But don't have your provider tell you just use Debrax, you'll be fine. That actually will do nothing and might make it even a little bit more annoying.
Oh wow.
Because it moisturizes the wax.
What you're saying is if you're feeling like they're trying to send you home to deal with this because it's a time-consuming process, that you should push for it and go, no, I want this done here by somebody who knows what's
Or you
doing.
can say, I'll use the Debrax for a week and I'll come back and see the nurse.
Yeah, okay.
Or I'll come back and see you. But I don't mind cleaning ears at the Saturday walk-in clinic at all. I think it's one of the great kindnesses we do in medicine. Anyway, if the ear lavage is no help, a referral to an audiologist can be done, and it's not. I wrote that it can be done easily. It can be done easily in that there's one in Humboldt County who's great, but there's nobody I know of here. I think there might be somebody in Brookings. There was for a while, but I don't know if they're actually there anymore, or if California-based insurance will get you to Brookings.
Yeah, right.
Yeah. But don't assume. This is what people who are hard of hearing do all the time. If everybody around me would just stop mumbling, then I would be fine.
Yeah, that should be your
not
first
true.
indication. Right.
That's absolutely not true. Take it seriously. And if you have to have your ears cleaned out, if you're one of those guys with Mongolian ancestry, then which is almost all of us, then you might have to do it yearly. So take it seriously, because 8% of all dementia worldwide can be corrected by something this easy.
That's remarkable.
Right.
So is it just, I mean, as part of it at least, I mean, if you think of, I know the brain isn't a muscle, it's an organ, but if you think of it as something that needs to be used in order to stay in top form,
Right. Right, you read ahead, didn't you?
A little bit, but also when we started talking about the isolation being
Right.
inimical, yes, inimical. Yeah. If you're not firing those neurons, if you're not firing your brain in
Right.
some fashion, and again,
Right.
exercise does that, being engaged in your surroundings does, being able to hear what's going on around you does that.
Right,
So,
getting good sleep.
so is that something that kind of the mental engagement
Right.
helping with dementia, is that like across the board regardless of the cause of dementia? Or
Yeah, totally.
Okay.
So weirdly, people who are young, so for all you young people who think this isn't relevant to you yet, making choices to pursue higher education in your youth and young adulthood, and especially helping to continue through that intellectually engaged, is super helpful. So if the newly graduated Del Norte High School student is like, yeah, I'm not going to college, I'm going to take a gap decade, I'm going to, kind of drop out of this, you are increasing your risk for dementia. So just the fact that somebody has more education can decrease their risk for dementia. And I think this is probably multifactorial before you go there.
You saw that happening?
Yeah, I saw your little brain working there.
That seems kind of elitist.
I don't think it's meant to be. I think it's just an observation of data. And so there's probably a bunch of different reasons. Reasons for this. One is if you're more intellectually engaged. So if you decide not to go to school, but get your education somewhere else.
I wouldn't say you don't even have to have an education. I think if you have an avocation or a vocation that engages you mentally.
But that is
on the
education, in my opinion.
Well, yeah, but the way you framed this in the education, it makes it sound like you have to go to school.
No, you don't necessarily have to go to school. You could I don't know, go to an ashram. You could go to learn motorcycle mechanics.
I'm just saying you could have a job that it was
Right.
not, is problem solving.
Yeah, it's problem solving. Yeah. Video games might do this.
Might,
actually,
yeah.
as long as you're not just playing the same game over and over and over again. Yeah.
Because
So
it seems like it's the diversity of experience in the neural landscape, right? It's just firing
right.
things. And,
Find a reason to like to learn. I
Yeah.
think that's what we're saying.
Yeah.
Really.
Yeah.
Find a reason to like it.
but understand, learning isn't just what you do with the book. It isn't just what you do with learning a topic or a
Totally
subject.
get it.
It's
Totally
anything
get
that works your brain in the way and lets it be as malleable as it needs to be.
Yeah, and especially people who can solve problems from a lot of different directions. That seems to have something to do with it.
Do with what?
Do
Not
with
getting dementia?
Yeah.
Yeah.
So, super helpful, super important. And who would think of that when they were 23? I didn't.
Who thinks of anything?
I know. Who thinks of anything?
Not to get down on you kids, sorry. No, I don't mean to cast aspersions on Gen Z.
And here's,
Yeah.
here's my favorite weird thing that you can do to decrease specifically your risk of Alzheimer's
Okay.
disease. Dental floss.
What?
Use it.
Use
Yeah,
it for what?
to floss your teeth.
That help? Well, yeah, I guess if you clean it out your ears helps it. I
Right.
mean, imagine, and of course, this is like a dental stuff and how it sort of just ties in with everything. It's just Lisa and I talk about this. My wife
Right.
Lisa and I talk about this all the time about what a travesty it is. The dental health isn't part of standard health care and insurance.
I know. I totally get that. So there's a connection with a specific kind of bacteria, and this is newly understood, with the most common type of dementia, which is Alzheimer's disease. Like, really?
Really?
It's a thing.
Whoa.
Yeah. And the connection isn't fully understood, but really, would it kill you to brush and floss your teeth? I mean, like, really? So,
It
but
might.
the sad thing is, how does that affect the average dental order? I mean,
No.
we've already talked about Dental Caribbean, and it's there's been a couple of dentists who have had to retire lately, so it's on the community level even a little sadder. But Seventh-day Adventists stepping up to do a free dental clinic.
Really?
That's news in town, yeah.
When's this?
I don't really have
Okay.
too much information about it, but I bet since Stella Health is Seventh-day Adventist, I bet if
like
you
through
called
Stella.
there that they'd be able to tell you. But and sooner or later, Denise Schoenecker Doyle will have it on her Facebook page because she does.
I may have seen something about that actually
Right.
already, just
Right.
about a free all-day
Super
clinic.
exciting, and people are already getting in line. So if you're interested in that, I would find out about it.
This was happening at Open Door. Oh, I got to check this out. Anyway,
It might be and they might be using the Open Door dental van because
okay.
they, like we've talked before, they have a beautiful one and it's got everything you could possibly need except for a dentist. They even have X-rays. So, and they have 2 exam rooms, so they could, if they had 2 dentists, they could like make maximal use of it.
So again, we've talked about a number of syndromes, conditions like this, but this just boils down to it's more of a total health sort of thing.
Right.
Dementia is
Planning ahead, maybe. Yeah.
living like lifestyle,
Right.
right? I mean, like living now, because the way you live today
Right.
directly influences what happens to you downstream.
I think what I learned in this is that stuff that I never thought was relevant is relevant.
Like earwax and
Yeah,
Yeah.
like earwax. Who would have guessed
Flossing.
that? But yeah, and it's the other thing is that it's the gestalt of who you are and your health. Okay, so it's not just one thing. It's we focus in the exam room. You high blood pressure, take this pill, and very few people learn about the DASH diet. Even though it's such an important tool. So I wish it wasn't. I wish healthcare wasn't so, a privilege and was more of a right. I wish it could be seen in its like the entirety of what we could really do for people and what we understand.
it seems that the experience, the healthcare experience for everybody, for you, for the person who comes in to see you, everything is so atomized because it's all price pointed out, right?
Fractionated is the word that we providers use. Yeah.
Right. So you never get a chance to see the whole person. The person
do.
seldom, unless they go out of their way, just like you going out of your way. You never get a chance to understand your whole health scene. Like if you could take a snapshot of the entirety of your health picture and address it as such, it's always just this point, this complaint, this illness, this thing, this pill, this whatever to deal with it, then see ya till the next thing happens. And to actually think of like, I mean, wasn't there back in the 90s when we started dealing with when the healthcare system started changing, where they were like HMOs was like managed healthcare. You were supposed to be sort of
back in the mid 80s, I heard mumblings about HMOs and how that was going to be terrible, and there were going to be Medi-Cal mills, and people were going to be kind of run through without the art of medicine. And
oh wow, see, I
doctors
remember
were grumbling a long time ago.
I remember it being more about like looking at things like preventative health care and like sort of looking at, you've got like looking at a higher level, more meta picture of an individual than just dealing with individual complaints. But that may be me misremembering or having the wrong impression.
The Affordable Care Act actually focused on preventable healthcare. And in some ways that made it a little harder, I think, for patients and providers.
How
because
so?
Our 7.5 minutes now, you're there because you want to talk about your back pain, which is a super important thing affecting your life. But I've got to check all these boxes about your cholesterol, and have you had diabetes screening, and have you been to the eye doctor lately, and have, and this one kills me. Have you had your gonorrhea and chlamydia testing done lately? I mean, because, like, really? Can we target who might need that and who might not need that?
And whether or not that question is applicable to who you're sitting in the room with. And with and I guess if you've got 7.5 minutes and you've got a script you have to run through, then that's going to eat into that time.
Like a well child check is like tick, 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 tick. You just hit all the boxes.
Wow.
And if you're talking to a 12-year-old about gonorrhea and chlamydia screening, first of all, they want to die because their mom's in the room. And second of all, 99% of the time, it's not relevant to them. So what I use I don't use it as we're going to screen you because we don't trust what you're telling us. I use it as you might know somebody that needs this information. Come see me at teen clinic. Yeah.
That's just good to know. Good knowledge to have.
And most of the moms don't find that as threatening.
Because it's not their kid.
Yeah. Well, but exactly. You kind of divert it from your kid.
Right.
That's true. So, it would be super nice if we didn't fractionate people. But acute care does that, and I'm like big fan of acute care. It's just your ankle. We're only doing your ankle.
Acute care is supposed to do that, right? It's acute. Yeah,
right. Yeah. But I think the solution is maybe not 7.5 minutes.
Yeah. Or another thing is maybe, if we okay, so while we're fixing the healthcare system, let's also fix the educational system and teach kids, like, instead of just like, oh, here's a week on nutrition we're going to do it 1 year. I mean, no, these sort of lifestyle classes where this is why you eat this and this is what happens because, the same sort of, teach you how to do your banking or whatever, but to understand the Mediterranean diet, the DASH diet.
To understand why we're making you walk the track, although that's uninspiring.
And you might feel like, oh, your foot, your whatever, your butt's lazy right now today, but this is for your brain in 6 decades, and that's wow. Yeah, and we're just left to sort of find that stuff out, and it never seems to be presented in any sort of conscious way to anybody.
Instead of not relating to how grandma is, why don't you never be grandma? Because she would really like that.
Yeah.
As far as dementia.
And I don't know, and I don't know how that works in my own like family history. Like, I've had a great grandparent and a grandparent who both had dementia, but they were in their 90s. They stayed around. They stuck around. So I mean, is there a point with dementia with decline like that is just hardwired into the beast? Yeah.
Apparently not.
Really?
Yeah.
Really? So I should be worried about that then.
Yeah, you should.
Okay.
Oh.
Well, thanks.
Something to think about at 2:00 in the morning instead of having opening the door for the cleaning crew.
Yeah, I'm still in here. You button up against the door outside my brain with the vacuum cleaner. Well, dementia, it's something to address right now. Something you can deal with right now.
And it's easy. It's not like inevitable.
Yeah.
Yeah.
That's kind of.
And these are easy things. Mm-hmm. I mean, if your back hurts and you can't really do 150 minutes of exercise, although you could in the pool,
you can do it in different ways. Yeah.
Maybe you can floss your teeth.
Yeah. There you go.
There you go.
And Lisa and I will see you on Friday night. I was talking with her. Oh no, we can't do it this Friday. She's out of town. But yeah, I want to come down. I want to come swimming.
Oh,
I
cool.
really want to do that. I want to come down to the pool and do that.
Awesome.
All right. That's it for this week's Health Matters and dementia. And again, saddened, I'll mention her one more time, but Stephanie Jones. I just saw another thing on Facebook while we were talking here today, and it's just a sad thing. A person who is I don't know. In my mind, it seemed too young to have to deal with this, and had to deal with it for a number of years, and has finally passed because of dementia. And so, yeah, get out, walk, eat healthy, get good sleep, take care of yourself. All of these things matter.
Yep.
Okay, there you go. Anything for next week yet?
I don't know. It's something that'll catch my eye, I'm sure.
Okay. All right, Lynn Szabo, thank you very much. And we'll talk next week on next week's Health Matters.